Hello everyone, I am Dr. Mahesh Shanmugam, Chief of Vitrectomy Services and Ocular Oncology at Sankara Hospital based in Bangalore. It's really a pleasure meeting you all virtually, but it would have been wonderful if we could have met in person. I look forward to the day when I can see you in person. But this pandemic has ensured that all of us are confined to our houses and following physical as well as social distancing and wearing a mask. This pandemic has touched every human being in one way or other. It could be a very, very simple fact of wearing masks and maintaining the distancing. But there were those unfortunate 7,000 health workers who have lost their lives trying to save other people. Hope is something which we seem to be losing amidst the pandemic, but it is not a good idea to lose hope. Hope is something which is eternal. Hope is something which is eternal. And what I have learned about hope is what I have learned from our patients. When you look at the person behind the patient, they teach us the value of hope. And without hope, everything is lost. So let's look at some of the stories which I have come across in this practice of the last 20-25 years and what hope can do to a patient. Let's look at some stories. We'll start with the story of a young sales executive. This gentleman was recently married and was looking forward to a happy life, but then he developed a slow-growing tumor in the eye. The question was, will this eye need removal? So I was faced with the distraught young wife and family and this young sales executive who looked for hope against hope, trying to save the eye. So this is how his eye looked when I saw him. He had this mass lesion growing out of the eye on the nasal side of the eye, and there was his vision was normal. He had 6/6 vision, but this mass was exerting a mass effect on the fundus. We went ahead and did a biopsy, an incisional biopsy, trying to see what the lesion was. Unfortunately for him and us, the incisional biopsy showed that it was a ciliary body schwannoma. It's a particularly rare tumor. I haven't come across one in the last 25 years of oncology practice. Unfortunately, this was a benign tumor, and we went ahead trying to remove the tumor. So this is the surgical video where we see a full thickness cleral incision being made. And what we see here is the area where we had done an incisional biopsy. So we are uncovering the ciliary body and the choroid very, very carefully, taking care not to rupture it. And what we see here, the white lesion is the mass, is the schwannoma, which is growing on the surface of the ciliary body. So very careful dissection of the ciliary body and the choroid was done. And this mass was peeled off the choroid very carefully, and using an endocryo to hold on to the tumor, we removed this mass. So then the scleral flap was sutured back, and in the process, the site where I had done the incisional biopsy had opened up, and some amount of loose tumor was sticking onto it, which was removed using the endocryo, and subsequently it was completely closed. So this is his postoperative appearance. There's no tumor, and he continues to maintain 6/6 vision, and his hope was rewarded. Similarly, there was a young migrant worker whom I had seen about 10 years back. So he was the only son, and this family of mother and son had lost the father some time back. And mother and son were sitting and crying on the platform in Bangalore because when the passers-by stopped and asked the mother what had happened, the mother said the son had been advised removal of the eye for a tumor. And these kind passers-by actually brought them to the hospital and offered to take care of the surgical costs as well because the patients were extremely poor. And when I saw them, he had this black mass growing in the anterior chamber. And initially it looked like a melanoma. A melanoma is a malignant tumor which would have to be removed. But then this jet black pigmentation indicated this was not a melanoma and possibly a benign tumor, which is a melanocytoma. So we went ahead and resected this tumor and the underlying ciliary body and iris. And this is the postoperative appearance. I saw him about 6 months back. He is now a gentleman of 28 years. He's married and he has got a child and a happy family. It was really the hope was rekindled when I saw him in the clinic. This is the story of a precious child who was conceived after multiple abortions. It was born premature, but then when the mother saw the mother saw that both the corneas were opaque and one eye was tricycle when the parents took the child to the ophthalmologist. And an ultrasound showed a complete retinal detachment and the child was blind. And ultimately they had a precious child which is bilaterally blind in both the eyes. So hope against hope, we decided to do something about it. And this is how the eye looked with the corneal opacity. And we removed the cornea and removed the iris as well. And beneath that was the cataractous lens to which the retina was attached. Very carefully, the lens was removed. And then we can see the retinal detachment and the fibrous tissue which was pulling up the retina. This looked either like a FEVR, but the child was born premature, so it could have been a prematurity-related traction retinal detachment as well. So this is one of the rare situations where an open sky vitrectomy was being performed. So all the fibrous tissue was removed, open sky, and under fluid and under viscoelastic. Very gently, all the fibrous tissue was removed and the retina was pushed back and the cornea was replaced. The retina went on to reattach and the child was having ambulant vision when I saw the child last. Human beings are a species which harm another just for the sake of the borders or just because they hate another person. So we saw a 20-year-old Yemeni war victim, the victim of vagaries of the war which is happening in the Middle East. And he was a pathetic sight to look at. He had no arms below his shoulders and no legs below his hip. And he was bilaterally blind as well. He needed assistance for everything. So he had been given up, told that nothing can be done. I was looking forward to a very, very bleak future. Wondering if there is something that could be done. And the ultrasound showed a totally disorganized globe with the retinal detachment. So this is how his eye, which was not looking pre-tricycle. So the iris was stuck to the corneal wound. So he opened it up and the cataractous lens was removed and we found a metallic sharpener right behind the lens. And inside the eye was completely disorganized. The retina, whatever was left of it was detached with a serious fibrous tissue scarring in the superior part of the retina, superior part of the globe. This was because of globe rupture and through which the fibrous tissue had grown and detached the retina, and about 1/3 to half the eye was covered with fibrous tissue. So here the forceps is passing in the subretinal space to peel the subretinal gliotic membrane, and this is the glial tissue and PVR which is being removed in the periretinal space. One of the inferior retina was looking reasonably healthy. The superior retina was completely replaced with fibrous tissue. There was some clot and bleeding, and hardly anything could be seen, but with careful dissection over time, we could see that the inferior retina could be salvaged to some extent, and the superior scar tissue was being trimmed as possible and left in place. So this is the peripheral retina. Once again, the subretinal band is being removed using the forceps in the subretinal space. And this dissection had to be carried out with the microscope visualization, with and without the wide-angle viewing system. The blood clot was removed. Yes, it was looking particularly nasty inside the eye, and the retina was carefully dissected off the fibrous tissue, and subsequently with perfluorocarbon liquid we managed to attach the retina. So that's the edge of the retina, what we see, and the laser photocoagulation marks. And superior retina was again replaced with scar tissue, and we could not do anything much about it. That's what you see here. This is the scar tissue which you see here. So this gentleman who cannot move around by himself ultimately got back some vision. He is able to recognize people with his only eye after this surgery. Of course, we cannot remove the oil, and he may need repeated corneal transplant, but then we were able to give him some hope after all these surgeries. India as a country leads the world in road traffic accidents, and we came across a 34-year-old gentleman who met with an accident, a two-wheeler meeting an accident with a lorry, and he was in coma for a month. So he didn't know that both his eyes globes had ruptured, and he woke up a month later to blindness. So both his eyes, he had only light perception vision, and both his eyes had extreme retinal detachment, the closed funnel, under very, very low intraocular pressure. This is the surgery of one of his eyes. So what looks like the retina with the vascularization is actually the fibrous tissue. This whole thick tissue is fibrous tissue, and the retina beneath it was completely detached. This is the worst eye. The better eye had retinal detachment with lens in the subretinal space, which we managed to remove and reattach the retina. Here again, the fibrous tissue had to be dissected bimanually. So what we see here is bimanual dissection of the fibrous tissue, which looks like another retina in front of the retina. The retina was carefully removed, and using perfluorocarbon and a very, very gentle dissection, we managed to remove most of the fibrous tissue. So bimanual dissection with the scissors and the forceps had to be done. Then when we went back inside and done some more dissection, releasing the retina from this scar tissue, and once again come back, anterior fibrous tissue is being removed using the microscope illumination and visualization. And this is the posterior closed funnel with the little fibrous tissue there. So now we are able to see the retina after having removed all the fibrous tissue, and the pre-retinal membranes were removed. This little node was there over the optic disc, and I tried peeling it, it bled. So we stopped the bleeding and removed the clot, and ultimately whatever was left of the retina was reattached with perfluorocarbon liquid and laser photocoagulation. So this is his fundus appearance in the postoperative period. The retina is attached. Last I saw him, he came by himself. So he is able to move around by himself. But this story does not have a perfectly happy ending. His father, who was with him all along during the accident and subsequently when he was in coma, and he's the person who is to bring him over for the surgeries, suddenly passed away due to a heart attack. So the responsibility of taking care of the family has fallen on him. But then he has enough vision and he is gainfully employed and he is taking care of the family now. Children with retinoblastoma do have very, very pathetic stories behind. So this is one such. This was a 1-year-old child with bilateral group E retinoblastoma. One eye was enucleated and the other eye also was looking as though it may need removal because it is group E. In this process, what happens? The father abandons the family. This happens very often in retinoblastoma families, particularly from the lower socioeconomic group. So it's up to the mother to take care of this child, which has got no vision in both the eyes. And the mother, who was a household help, was braving all odds to bring the child for follow-up. And the child was doing okay as far as the tumor is concerned, things were coming under control, but suddenly lost vision. And these blind children are clingy and irritable, and you just cannot pry them off from the mother. What had happened was the child had developed vitreous hemorrhage when the tumor regressed. And this was an appearance, and the child had developed cataract as well. So usually we don't do a vitrectomy in a child with retinoblastoma, but in this child, this was the only eye left and the tumor was reasonably under control. So we were forced to do a vitrectomy, remove the blood from inside the eye. And this is, you can see the retina is completely studded with tumors. This is the posterior hyaloid which is being induced. And beneath this, the retina was attached. So that's the macula which is being uncovered. So what we see here, this is where the disc is, and the tumor is growing over the disc, and this tumor was dissected as much as possible. And all this is being done with the infusion of melphalan, a chemotherapeutic agent, and also we used distilled water. Distilled water kills the retinoblastoma cells. Distilled water was used intravitreally as well as in the subconjunctival space to kill any spilt over cells. And again, this child was sent for whole eye radiation. So if there were any leftover cells, they will also be killed. So last I saw the child, the mother was running happily behind the child in the outpatient department. The child was able to see and it was uncontrollable. It just went running around the place and the mother was running around happily trying to catch the child. Similarly, another aspect of retinoblastoma is the guilt of the parent in heritable diseases. So this was a 1-year-old child with bilateral retinoblastoma. One eye was enucleated, other eye was being treated with chemotherapy in another tertiary care institution. The mother had had her eye enucleated as an infant, and most of the time what happens is you can see the sadness in their eyes. They feel as though that they have transmitted the disease to the child and blames herself. And in this process of things, the child lost vision in the only eye due to retinal detachment. This is a regmentous retinal detachment. And usually when there's a regmentous retinal detachment in retinoblastoma, we may have to remove this eye. But once again, of late, we are doing vitrectomy in retinoblastoma. We're taking all due care. And this is what we did in this child as well. We placed an encircling band, and inferiorly there was a break, and so that was supported with a sutureless buckle. And we went inside very carefully, patient sclerotomies, taking care not to spill anything from inside the eye outside. And again, we used melphalan in the infusion. So you can see the retina is totally detached, and part of the tumors are active, and the tumor is over the disc and the macula, and severe PVR with preretinal membranes and thickened posterior hyaloid. The preretinal membranes were removed, and the thickened hyaloid was removed, and this was the area where the previous surgeon had done a cryotherapy, and the retina had torn there, along with part of the residual tumor being there. So we removed that scar tissue along with the residual tumor, and this is the tumor over the disc. This cannot be removed because this was going right through the macula as well. So we reattached the retina and laser and silicone oil. So this child did develop a recurrence because of proliferative vitreoretinopathy, which was again reoperated, and subsequently the child is seeing now. Hope that we're able to save this eye at least. This once again is subconjunctival distilled water to kill any spilled cells. Again, in these children, I would do an external beam radiation to make sure that there is no spilled cells which can subsequently result in metastasis. But then there are patients who give us hope, who tell us that yes, it is okay to take a chance for those who look hopeless. This is one such story. This gentleman was an engineer. He was an electrical engineer. He became blind in his only eye, and he was confined to his house for 2 years, and the other eye being lost in his childhood. So why he had become blind is because this only remaining eye developed neovascular glaucoma because of peripheral retinal detachment. And he was just confined to his house before he reached out to us. So all we did was remove the peripheral retinal detached retina, which was inciting the neovascular glaucoma, and the neovascular glaucoma regressed, and he has until today 6/9 vision. What is important is that over the last 10 years, every year, he goes around generating as much donations as he can to help other blind people. Similar is the story of these parents. So this child was a non-familial but bilateral retinoblastoma. So one eye after the other eye had to be removed despite all the best efforts. And sadly, the child developed metastasis and then died. 3 to 4 years it took for the parents to come to terms, and then the mother became pregnant. So we did a genetic analysis of the parents as well as a chorionic villus biopsy in the first trimester, and showed that the child did not have retinoblastoma, and they do have a healthy newborn. They keep coming to us once in 6 months, and they do also donate generously, but specifically for the care of retinoblastoma children. And this is the sign of ultimate hope, and hope all of you enjoy this and then rekindle the hope in our lives. Thank you very much.
I love you.